afternoon, everybody. My name is, can you hear me all right? All good? Okay, perfect. So my name is Angelica Ortega. I'm a second-year osteopathic medical student down in Southeastern University in Florida. So my presentation today is essentially the goal here is to present a narrative review of the current evidence for in preclinical studies of the benefits of gene therapy as a disease-modifying therapeutic approach for Alzheimer's disease. So I'm sure many of us have been impacted by Alzheimer's disease in our family or have at least heard about it. In fact, currently 2022 statistics show that 6.5 million Americans age 65 and older are living with Alzheimer's disease, and about 1 in 9 individuals age 65 and older have Alzheimer's. Half of those are women, and older Black Americans are twice as likely to be impacted by Alzheimer's or to have Alzheimer's as older white Americans, and older Hispanic Americans are 1.5 times more likely to have Alzheimer's than older white Americans. So this is something that's going to become even more prevalent with our aging population. So gene therapy as a potential approach to prevent, halt, or delay Alzheimer's disease is a growing field and has shown a lot of promise. So the 3 genes that my research looked at specifically were brain-derived neurotrophic factor, BDNF, nerve growth factor, NGF, and apolipoprotein E2 or APOE2. So we looked at studies ranging from 1980 to present day that showed the use of gene therapy using the vector adeno-associated virus in animal studies. And so we gathered that evidence and we saw that there were a lot of promising results. For example, APOE2 showed a significant reduction in amyloid beta burden, a neuroprotective effect, and as well as other protective factors relating to the decrease of neuroinflammation and a mitigation of cognitive deficits. And BDNF showed improved behavioral deficits in the Morris-Water-Maze test, which is a test for spatial learning in rodents. And it also showed a prevention of neuron loss and an alleviation of synaptic degeneration. Lastly, NGF showed improved distal synaptic activity and a retention of the ability to respond to growth factors with axonal sprouting, cell hypertrophy, and the activation of functional markers. So, and in the middle, the diagram there shows kind of the pathogenesis of Alzheimer's disease, and just below it shows the essentially the process of gene therapy. So we also wanted to present the current clinical trials that are ongoing for each of these genes of interest. So APOE2 has a phase 1 trial that is ongoing. And when I looked at the governmental site for the clinical trials, they hope to have results hopefully by next year, which should hopefully be promising. And BDNF also has a phase 1 trial ongoing. And NGF actually had a phase 1 trial that was completed and was well tolerated, showed that it was safe in the population of mild to moderate patients with Alzheimer's, or patients with mild to moderate Alzheimer's, forgive me. And so because of that, they went to a phase 2 trial. But unfortunately, this phase 2 trial, while it did show that it was well tolerated, there was not a significant reduction in the clinical outcomes for the patients. There was no significant reduction in the cognitive deficits that were that affected these patients. But that does not mean that this is over by any means. As I said, APOE2 and BDNF are still ongoing, and they could be proved to be very promising. And NGF2, despite the phase 2 trial, it could be that something was wrong in the it could be that there just needs to be a little bit more info and another trial could show something different. So as I have stated, the results were very promising in the preclinical studies, and hopefully many more studies will continue and will show that the gene therapy approach can be especially useful in the future as a disease-modifying therapy for Alzheimer's disease. So thank you, and I'll take any questions if you have them.
All right, thank you so much.
Thank you.